Hello and welcome everyone to our very special webinar today on the new paradigm in chronic pain treatment with Hal Greenham and Professor Howard Schubiner. I am really excited. We have an information-packed session for you all, and I know you are going to benefit greatly from what we have prepared for you. For those who don't know me, my name is Dava Haley Mitchell. I am the co-founder of the Shift Network, and I will be your host for today's session. So let me dive right in and introduce you to Hal Greenham and Howard Schubiner. Hal is a somatic psychotherapist who has pioneered mind-body treatment in Australia. He has 7 years of experience in private practice treating chronic pain syndromes. He's also a social entrepreneur and the one behind the Freedom from Chronic Pain program, which you'll have a chance to hear about later in today's program. Second, we have Howard Schubiner. He is a world-leading researcher and clinician in mind-body treatment, and he's written 3 books on the subject, including Unlearn Your Pain and Unlearn Your Anxiety and Depression. Howard is also a physician and clinical professor of medicine at Michigan State University. So 2 very well-informed men who also have a deep personal journey in this whole field. So welcome to you, Hal. Great to have you here.
Thanks a lot, Dava. It's great to be here.
And welcome to you, Howard. Really excited to learn from you today.
Thank you so much. Can I say good day, mate?
I think you can, mate.
I just did.
So let me take people into what we are going to cover today in this really powerful session. We are going to be covering the basic principles of recovery from pain. We're going to talk about how to apply these principles to your specific situation with your unique symptoms. We're going to talk about how to distinguish mind-body pain from other types of chronic pain. And then we'll also talk about how to start retraining your brain. And then at the end of this program, Hal and Howard will share details of the program. They have a really exciting new offering that's called Freedom from Chronic Pain. And they'll also be sharing a little bit about the therapy services that they've created to deepen and go along with the treatment. So with that, let's dive right in. And I would love to begin with you, Hal, to share about who is this program today designed for? Who can really benefit from the learnings in this webinar?
Well, look, Dava, I think it's a lot of people that could benefit. So, look, if you're a person watching this, you've seen a heap of doctors, maybe different practitioners, and you haven't been happy with the results that you've got. A lot of people with pain go on a big roller coaster ride of semi-successful or unsuccessful treatments, and it can really be quite demoralizing.
You know, there are so many people with chronic headaches, chronic abdominal or pelvic pain, chronic neck or back pain. Most of the time, these are the people that are going to benefit from this program, and especially for people who've had symptoms that your doctors just haven't been able to figure out what's going on or treat effectively. And it's also for people who are kind of tired of medications that don't work or cause side effects.
Yeah, and I think it's important to mention it's for those people who are open-minded to the idea of mind-body treatment. And when I say that, I mean the possibility that whatever your symptom is, wherever it is in your body, that just the possibility that it could be driven by the brain. Now, this includes many people who have really quite scary-looking MRIs and scans, which actually are often not the true cause of their pain. I thought, Howard, do you want to talk a little bit more about that?
Yeah, exactly. One of the most important findings that we're learning in medical science in the last decade or so is that most people who are healthy and have no pain have an abnormal MRI of their neck or back. In fact, if you look at healthy 30-year-olds, 50% of them have degenerative disc disease. 40% of them have a bulging disc in their neck or back. If you take 50-year-olds, those numbers are 80% and 60%, and it goes higher from there. And this may be a shock to hell, but I'm actually older than 50. So if you look at my the MRI of my neck, there's large bulging discs. I know, shocking. Shocking. There's large bulging discs and degeneration, but I have actually zero pain.
This is for people who are looking for an empowering approach to treatment. We really, in providing this program, want to offer people the skills and put the power into their own hands to really undertake their own treatment and reduce dependency on practitioners and medication.
Wow, I am really inspired already in hearing about both of you and some of the experiences that you've had, Howard, with your own symptoms that are not creating pain. And maybe we could dive a little bit deeper so people could get to know a little bit about your personal journeys and what brought you to this and why this whole topic of freedom from chronic pain has become so important to both of you.
Yeah, well, look, the personal dimension is so important, Dava, and most people in this movement have had a significant experience of pain themselves and recovered. So in my experience, yeah, I had terrible experience with pain starting when I was 28. I had a chronic RSI problem in both of my wrists, and then it spread to other parts of my body. I saw over 40 different practitioners. I spent over $20,000 on treatments that really just didn't work very well or did nothing. It got so bad I couldn't work. I had to give up my business. I had to give up my music. I was playing in a couple of bands. Got so bad I had to move back in with my parents. That was really hard. I was very debilitated. So I moved back to Canberra. I started a psychology degree. I had to ride around the university on a motorised scooter wheelchair for a couple of years because, I just couldn't walk around. So when I found the mind-body approach, it was just really extraordinary. It was like a light going on. I made quite a rapid recovery after having pain for about 3 years. I got better in about 50% better in 6 months, and then took me a little bit longer to do some of the therapy work to make a full recovery. But I don't have any pain or fatigue anymore. And so naturally, I've become very passionate about sharing this work.
Hal, that was amazing. My story isn't maybe quite as dramatic, but important, because everything was going fine for me. And then when I became a young doctor, my very first time as an intern, all of a sudden, it's embarrassing, but I got diarrhea for 6 months.
Shit.
It was literally that being a doctor scared the crap out of me, and that's part of the mind-body connection. But then when I was a young faculty member trying to rise and do my work and be a father and a husband, and I started getting neck pain, and this went on and off for years, and the doctors kept telling me that I had arthritis, that I had bulging discs, and it turned out it was really due to stress. About 3 years ago, my dad was getting sick, and I started having pain shooting down my leg. And then a couple years ago, it was my mom's turn. And then I had this horrible upper neck and back pain. And I've learned over the years that this mind-body connection is for everyone. It's part of being human. And we all suffer from having a mind, having a brain, and having a body. And these connections are really important and powerful to understand.
Well, it's very inspiring to hear both of your stories, and I appreciate both of you being so vulnerable about, your personal journey. And so what I know you're both up to is you are really creating a revolution and in efficacy. So maybe you could talk a little bit more about what is possible. And obviously you are here today. You've created a major shift in your own life, but I know that you're now doing that for so many of your clients as well. So paint a little picture of what's possible from your work.
Yeah, well, I think the clinical experience is so important in this. And sometimes I think as a clinician, you kind of almost get used to seeing miracles because so many people are able to make extraordinary recoveries with this work. Now, look, we're not promising that everyone who does this is going to make a complete recovery, but I think, it's just important to to report, that in clinical practice we do regularly see people making substantial or full recoveries from their symptoms, very, very diverse symptoms, and often extremely chronic, for years or sometimes decades. So, so that's another reason that we're really passionate about getting this out to people. You want to talk a bit about the science side?
Yeah, in addition to the clinical success that we've had and others who work in our field have had, the science and research is now there. Just in the group that I'm associated with, we've now conducted 7 research studies showing that people with chronic pain and other associated symptoms can recover. We're really on the verge of a paradigm shift that's happening now, and that's amazing.
Well, absolutely. I mean, it's a big word, isn't it? Paradigm shift. Mm-hmm. We're talking about what paradigm shift means, but I think it's, essentially it's driven by an underlying shift in the neuroscience. Only 10, 15 years ago, there really wasn't the evidence base to confidently say that the kind of changes we're talking about are possible. And that has changed now. And we really want to get that message out to doctors and practitioners, but especially out to the people who are suffering so that they can take the power into their own hands with that knowledge and move forwards with their recovery.
For the past 15 years, I've been studying the neuroscience on pain. And it's a little bit sad, but most physicians aren't being taught about pain. Most physicians don't really understand pain. And we've been fortunate enough to have these advances in neuroscience, and now we know that, first of all, not all injuries actually cause pain. Pain can only occur when the brain activates pain, when the brain generates it, and therefore, all pain is actually in the brain. And all pain is real. We're not talking about real or imaginary pain. Everyone who has pain has real pain. And anybody who says that the pain is all in your head is ignorant and cruel, because all pain is real. But it also turns out that the brain can generate pain in the absence of any tissue damage at all. This is amazing to understand, but surprisingly common. And because of this, we now know that the brain can learn pain once it occurs, and then it can continue to replicate it for months or years or decades. And that really is the neuroscience basis for the work that we're doing.
I think it's important to understand the extraordinary magnitude of the problem that we're trying to describe here. So Howard and I were talking yesterday about the raw percentages, the way that we see the data around some of these common conditions: back pain, neck pain, headaches, irritable bowel. Do you want to talk about some of those percentages we were talking about, of how many are we actually have proper evidence that they are structural organic conditions versus the larger percentages that, we think are probably mind-body?
It's actually shocking when you think about it, but the data is there. It's well known. If you talk to any neurologist and ask them, well, what percentage of the people who have chronic headaches, which are millions and millions of people, actually have a structural disorder that accounts for those headaches? And the answer is 2 to 3%. If you take people with chronic abdominal pain and pelvic pain, again, the answer is maybe 5 or even up to 10% have structural problems causing that, again, with chronic pain. And then the most amazing thing is that when you take people with chronic neck and back pain, it's actually maybe a few percent, or up to at most about 15% of people with chronic neck and back pain, we can document that there's a structural cause for that. And so when there's an absence of the structural cause, now we need to look at the mind-body connection to see if we can identify what's actually causing the symptoms. Because you can't resolve these symptoms unless you find the cause. And so we're really working at getting to the root cause, which, and that in and of itself is revolutionary in the treatment of chronic pain.
So it does sound extraordinary, but yeah, just to really make that point, that we're talking about a treatment that we truly believe has the capacity to bring relief to many, many people who are suffering in chronic pain at the moment, and also to do it naturally without drugs or surgery. Yeah, so essentially, we called the topic of this webinar the new paradigm in chronic pain treatment. And the new paradigm is essentially going from trying to manage pain to a recovery focus. It's really about going from management to recovery in chronic pain.
Paradigm shifts take a long time to occur. It takes a lot of work and refinement. And usually when the new paradigm comes around, it's often misunderstood. It's often resisted. We are seeing that. But once the paradigm shift is there, it starts to occur, it's obvious. And we're at that point now. People who begin to look closely at our approach see that. Our patients, our clients who are working in this model can say, oh my goodness, this is amazing. How come everyone doesn't know about this? And we keep saying they will. And that's what this program that we're offering is really about, is scaling it up to a point where more people can take advantage of it.
Yeah, look, and on that, I really want to acknowledge HCF for inviting us into their Slingshot Catalyst Accelerator program earlier this year and supporting innovation in chronic pain treatment. It's really wonderful that, they've written an article about us in Health Agenda, and they're helping to get an innovative approach to treatment of chronic pain out there.
I really love what you are both saying about this paradigm shift, and it is so heartening to hear. I can think of so many people in my own life who've suffered with pain, and that they can really move towards recovery, and that pain-free living is something that is not just a fairy tale, but is becoming a reality for so many people, including yourselves. So let's talk about this more practically, dive in. How does it really work? And share with people a little bit of how they can experience this in their own lives.
Sure, Dava. Well, I think correct diagnosis is really the foundation. Perhaps, Howard, you want to talk a bit about that?
Yeah. As I said, to get to the root cause, you have to know what you're dealing with. And so the first step is saying, well, is this a condition that is commonly seen as a mind-body condition, like the ones we talked about with some of the chronic pain syndromes, oftentimes tinnitus, ringing in the ear, dizziness, anxiety, depression, chronic fatigue, insomnia. These are some of the common things that we treat. And so if something is not explained by medical testing, routine medical testing, if the tests are normal, if the MRIs of the neck and back are showing the normal findings that we expect due to someone's age, then we're looking at, well, we want to rule in and get the evidence that it actually is a mind-body condition. When someone has back or neck pain, and then they go on vacation and it completely disappears for a few days, that's evidence. And then we got it. We can see that. I had a patient who had severe typing pain, kind of like an RSI, what you were suffering with, Hal. And it hurt every day, Monday through Friday, got worse and worse and worse. And when I asked, does it bother you at any other time? And she said, yeah, it hurts on Sunday evening when she hadn't been typing. And again, now we see that. And the evidence points then to ruling in a mind-body condition. And then you can be confident of what you're dealing with. And when you're confident what you're dealing with, the treatment just flows from that.
I think another thing that's really important to mention is that, we're not claiming that we're able to treat all kinds of chronic pain. We're not claiming that this is a treatment for chronic pain from cancer, from autoimmune disease. There are many forms of chronic pain this is not an appropriate form of treatment for. But look, we get quite deep into the diagnosis and some of these systematic characteristics in the program, because it's such an important part of beginning the treatment. And then I think moving on from that, once we get some clarity around the diagnosis, we move into the treatment part, and there's two tracks which are important for most people. There's firstly their relationship with the symptoms and being able to shift the brain out of reactivity to the physical symptoms. And then there's the emotional work, which is understanding and working with the underlying stress or emotions which usually drive the symptom formation in the first place. Howard, do you want to talk a bit more about changing the brain and the idea of neural pathway pain?
Yeah, exactly. What we've learned is that, as I mentioned before, the brain can learn pain, and it does it through what we just simply call neural circuits or neural pathways. Neural circuits, neural pathways are how we do everything, how we know how to ride a bike, how we talk, how we gesture, how we walk, how we laugh. And what happens is that there's a danger alarm mechanism in the brain that's fueling that pain because the brain is afraid. It's trying to alert us to something. The brain is creating pain as a form of alerting us as the message that we're in danger, there's something wrong. But what happens is the more pain someone has, the more the pain itself further activates this danger alarm mechanism. The more somebody focuses on the pain, worries about it, pays attention to it, the more that drives the continuation of pain. And what we're doing is giving people methods and techniques of interrupting that cycle, which is amazingly powerful in little by little turning off the pain.
Yeah, and I think something is really important to cover here, because a lot of people say to me how is it that this treatment is appropriate for so many different conditions? I mean, if someone's got pain in their leg, they need to deal with their leg, right? Well, I think the thing that we're finding is that often someone will have an initial injury, but the body is very good at healing itself, and the chronicity of the pain is really driven by the brain. So, so I think that's why we're claiming that this treatment is appropriate for many different forms of musculoskeletal pain, irritable bowel syndrome, RSI, fibromyalgia, chronic fatigue syndrome, many neurological-like symptoms like tinnitus, vertigo. They're extremely diverse symptoms, yet they have a common cause. And I think it's understanding this brain or this neurological basis that is really fundamental to getting people on the road to recovery.
And oftentimes what we see is, if you look back at someone's history, which you can see in my history, there are several times in people's lives where they've had one of these conditions or another. They come and then they go, and sometimes one substitutes for the other. And when you understand this model, when you understand this paradigm, all of a sudden it becomes clear. You can see what's going on in someone's life, and you can begin to see also that oftentimes the symptoms start at a time of great emotional stress, great emotional discomfort, when in fact people feel endangered in a way in their lives. And that's an important part of this work as well.
Absolutely, and that's a really interesting piece. And I've found in my work in private practice as a somatic psychotherapist, people, maybe they've read one of Dr. Sano's books and they kind of recognize that there's probably some kind of emotional or stress or trauma-related component, but they kind of are not too sure what it is. I mean, that's very common as well, isn't it? That people will experience something in their body, but they can also find it difficult to connect that to, what is the cause of this? Where did it come from? And sometimes there's a whole piece of work that needs to be done around, let's try and work out maybe what some of the triggers that might have been going in that person's life. It could be something, a person in that person's life, their boss or a significant relationship is triggering something from the past, might be a family relationship. So an important part of it is kind of digging a little bit deeper, trying to get people more in touch with what some of those triggers might be.
Right. It's amazing how often we see where something is weighing on somebody's mind. Some situation, they may feel trapped in some way, trapped in a job or a relationship, or something's going on, and then all of a sudden, one day, they wake up with pain. Where did this come from? Just out of the blue. But this has been weighing on their mind, and then the danger alarm mechanism in the brain just triggers this symptom as an alarm. It's like a smoke alarm. When you get enough smoke, the alarm will go off, and that's exactly what we see.
Yeah, so it's really interesting, isn't it? I mean, the danger alarm mechanism in the brain, it seems that it can be triggered both by physical stimuli within the body and also emotional stimuli. But the kind of manifestation of the neurological response is essentially the same.
Exactly. There's really good research now using functional MRI of the brain showing that when you give someone a physical injury and scan their brain, or you give them a, quote, emotional injury and scan their brain, it's the exact same parts of the brain that are lighting up. And this is how our brains work. And that's why we see symptoms that can become chronic that are not due to an actual tissue damage situation. And this is the paradigm shift. And this is understanding that is amazing and common, but also shocking to most people.
And hopefully liberating, right?
It is amazing because once you see this pattern, once you understand it, you can't unsee it. And it becomes obvious. And I think, as Deva said just a minute ago, you can see this pattern in people you know. There's nobody who's not touched by people in their lives or their workplace who has one of these syndromes. They're amazingly common.
Yeah, I think another really important thing is practitioners. You know, what often happens, people will get that symptom, terrible back pain, and, you know, what do? They go to the doctor, they go to the physio, and if their practitioner hasn't studied the latest neuroscience, and, you know, there's a lot for practitioners to keep up with, what tends to happen with people is that instead of the mind-body causation getting taken seriously as a diagnostic option, they'll often be funneled into a kind of physically oriented treatment program. And unfortunately, that can often worsen the symptoms, right? Because we're not really addressing the cause. People get worried about a scan, or they get worried about, you know, maybe I've got cancer or something that hasn't been found. And then the fear builds up, and often the fear cascades into worse symptoms because there it is, the danger alarm mechanism, right?
When you treat a symptom that's actually caused by a mind-body condition, by a neural circuit, but you treat it in a way that reinforces that it's a danger, that it's a physical problem, you label it, you cause more fear, typically it will get worse over time. And the research on people with chronic pain shows that most people get worse over time rather than better. This is a tragedy in our medical environment today.
Yeah, and I think fear is such a massive theme in it, right? Fear and disempowerment. And so our hope with this program is that we can provide really good information and systematic, effective processes for understanding and treating the actual underlying problem, and in that way provide a genuine pathway to recovery for people.
That's exactly what this program does.
Well, it is really inspiring to hear all that you're talking about, and you know how detailed it is, but how much possibility there is for recovery, and how many different kinds of symptoms you can address. It's really very, very inspiring. I know, Howard, you had a little bit of a technique that you want to describe to people to really apply some of what we're talking about in their daily lives. So could you dive into that now?
Yes, one of the basic ideas of interrupting this pain, leading to worry about pain, leading to pain, is to have a practice of training your brain to separate from the pain. Once you understand that the pain or the symptom is not actually dangerous, you're not actually in danger, That's where the diagnosis comes in. You can begin to detach from it, to worry about it less. And that is a really powerful way of turning off the neural circuits causing pain. So, for example, if you for a second now just notice that you're breathing, if you just breathe in and breathe out, if you just watch your breath, what you're doing is you're noticing that you're breathing. You're not trying to change the breath, you're just noticing it. In the same way that as a child you might have watched clouds in the sky, you're just watching with interest and curiosity. And then, once people understand how to do that, which is very simple, they can then begin to notice the sensation that they might have in their body, in their stomach or their head or their back, and notice that in the same way. Pay attention to it with less fear, less worry, less concern. Just watching, just detaching, just noticing and seeing what happens. Oftentimes the symptom will shift as you do that. And when you see it shift, what you're seeing is the neural circuits are beginning to shift. And when that happens, you can see that progress is being made on a micro level toward recovery, toward healing. And that's one of the basic techniques, although there are several others that we use.
In terms of practical content on the emotional side, so in the program, we use the metaphor of the inner child, getting in touch with the child within and then working out what needs to be done after looking after that in order to look after that child. So some people have a kind of, recoil or response to the idea of the inner child that, it's a bit woo or something. But I think, if we look honestly within ourselves, think about some of the arguments that you get into with your partner maybe. Reality is
it's right there.
There's a child within all of us, right? And so a very powerful practice, and there's many ways to go about this practice, is to work with writing, or some people do it with a little meditation and in a dialogue. We offer a number of processes for this in the program to kind of take people into this inner conversation. Essentially, it's about making contact with that inner part of you and working out, well, what's happening? What am I actually feeling? What do I need to do about it? Is it that I just need to comfort myself and calm myself? Or is it that, I'm in an unhealthy situation and I need to make some kind of change in my life, take some decisive action? There's a range of things that as the adult we need to do to look after the child within. So, so we offer a range of processes in the program to take people deeper into that work, and that inner relationship systematically builds over time. And our hope in the program is that not only does it offer tangible tools for improving people's experience of the chronic pain, but it starts to actually build the foundations for creating mental health moving forwards.
This may seem odd to people, but pain or symptoms that our brain generates is a message. It's a message that our brain is giving us. In the case of a physical injury, the message might be you have a broken ankle and you need a cast. But in the message of a mind-body condition, the message might be you need to take care of yourself. You need to stand up for yourself. You need to ask the question, what about me? What's going on here in my life that is threatening or dangerous that my brain is sending me a message about? And when people begin to understand that that's how our brains work, it can open up a whole new arena for understanding ourselves and moving forward in our lives.
Absolutely. In somatic psychotherapy, we often say, the body expresses the unconscious mind. So the question that we're kind of posing is, what is it that your body could be trying to say? What is that inner part of you trying to say? What does it need? And I really invite people to reflect on that question in their own way, whether you want to do it as writing or you just want to go right inside and ask yourself, because usually that part of you is there wanting to connect. It's just that we're often taught systematically to actually neglect our emotional needs, because of the culture that we have in our society around it. We're often very focused on being great at work, looking after other people. Sometimes we neglect ourselves.
Do you have any case examples or stories that bring that to light?
Sure. Well, I worked with a woman recently who was experiencing terrible abdominal pain. She had really bad irritable bowel syndrome. She consulted some of the best gastrointestinal specialists in Sydney. Mm-hmm. And they said, look, we can't really find anything wrong. It was frustrating to her because she consulted the best people, but they couldn't really point her in the right direction. So when I spoke to her about what she was working with, I was curious to help her to connect with her inner self, her inner child. We did a meditation, and it was amazing. Within 5 minutes, all of these tears started welling up. Mm-hmm. And she had the realization in that moment that the divorce that she had experienced about a year earlier, which was around the time that the symptoms started showing up in the gut. So it was reminding her of this experience that she had in childhood that she wasn't aware of. And it was quite extraordinary once she got in touch with those feelings. And I guess that's what we're talking about, getting in touch with the inner child. Then the physical symptoms within a couple of weeks were just able to pretty much completely disappear. And she was just amazed. And she didn't have to she was doing a special diet, she just was able to let go of that. I think that was a good example of how the feelings link to the symptom.
Yeah, it's amazing because medical treatment in those circumstances is more linked to symptomatic treatment, but not looking at the root cause. And here, within a short time, you can find the root cause, and you can see that even symptoms that are very severe can be due to neural circuits. And neural circuits can turn on and turn off. I saw a woman who was a young woman who had severe back pain that started just bending over at work and picking up something. And it turned out there was nothing major going on in her life at that time. I mean, there were a few things, but nothing major. But what happened is she got so afraid of the pain itself. And the doctors kept telling her, do this, do that, try this, try that, and nothing got better. And she got more and more frustrated that she got better without doing emotional work. She got better by reducing fear about the symptom. She started moving with less fear. She started challenging herself. She was realizing, oh my God, there's really nothing wrong with me. And within 3 months, she was back to running. She sent me a picture of her surfing in Hawaii. I mean, the exhilaration that she had from this simple intervention was just amazing.
That's fantastic. And sadly, a lot of these people might end up in surgery, right?
It can happen. There were, in the States now, we're moving toward 1 million spinal fusions per year. And most of those are due to, quote, degenerative disc disease, bulging discs, and chronic pain. In the absence of any severe neurologic compromise. I send people for surgery sometimes. I'm not against back surgery when it's necessary. But it's sad to say that a lot of these surgeries are actually unnecessary.
It is sad to hear about the amount of surgeries and things that are being done for things that could otherwise be healed significantly through non-invasive and non-medicated interventions. So I think, You have both shared so much amazing information, and I would really like us to shift gears now and really share with people more about this beautiful program that you've created, Freedom from Chronic Pain, so that those who are hearing this that might be experiencing their own types of symptoms related to pain can potentially engage in your program and hopefully get some relief. So let me just share a little bit about this program as I understand it, the very brief nutshell, and then I'd really love Hal and Howard for you to dive in with some of the details for what you've created. So as I understand it, the Freedom from Chronic Pain program provides a structured approach to recovery and walks people through each step of the journey. In addition to that, you provide community and you give people the opportunity to be as in touch or as little in touch with other people as they want to, who are also experiencing chronic pain. Many people are suffering alone and would really benefit from getting to hear from some other people who are having similar experiences. And there's a lot of relief that just comes from knowing that you're not alone and there's others with you if you want that community connection. You also are providing a program that is supported by therapists who themselves have been through this program or a similar approach and have recovered from more severe pain themselves. So bundling the approach with tailored support is something that is really, really helpful. And then finally, your program lays the foundation for ongoing physical and mental health. So I know what you've created is so amazing, and I'd love you to share a little bit more. Maybe we can start with you, Hal, about the primary benefits that people who choose to enroll can expect from the program.
Okay, sure, Dava. Yeah, well, I just wanted to make the comment that part of the reason that we've created this program is to try and get the knowledge out there. And the extraordinary thing about this approach is the knowledge can be the curative thing. So it's not that people necessarily even need to work with a therapist like myself or a doctor like Howard. Many people will be able to get substantial benefit or full recovery just from doing the program. But sometimes that extra support is also important, and so we have trained a number of therapists who can specifically guide people through the exercises and to do the brain retraining and the emotional work that they need to. So, so in terms of the primary benefits, as we've said, we're really talking about shifting the paradigm. It's about going beyond endless treatments and getting people on the road to recovery towards pain-free living, or at least to the point where pain is no longer the primary issue that's kind of guiding people's lives and their choices.
And one of the things we've seen so commonly is that anxiety is a major part of this process.
Absolutely.
And so a lot of people have had anxiety in their lives and then they get pain. Or they get pain and then they get anxiety about the pain. And so what we found is that we're treating both at the same time because the same tools, the same techniques are useful for treating the pain as well as the anxiety that might be underlying it. So the freedom that comes with that is remarkable.
Absolutely. It's extraordinary. I mean, we've got epidemics now of both pain and anxiety, and we think, well, that's because they're originating from a similar root, and we've really designed this program to basically address that at a fundamental level. So my hope is that people who really invest in this work will get beyond having to spend all of their time and energy coping with the pain to really getting back into a life that feels purposeful and full.
And this epidemic is shifting into younger people, teenagers, children. It's really an epidemic in our society, and it's sucking away so much energy from what people want to do, what they need to do, how they can define themselves and create who they are, especially in their early lives, that it's liberating. It can be liberating in that sense.
Oh, absolutely. I think of, the 3 or 4 years I spent in pain. I mean, I feel like I'm living a different life now.
Yeah. What did you accomplish during those 3 years?
Well,
Probably not much.
Well, maybe there's value in the darkness as well. I did learn a lot about myself. It gave me a lot of gratitude. It gave me a lot of gratitude for having my body back when I did.
Hope is often lost.
Oh yeah.
Hope is often lost, and people go down that rabbit hole, and everything they try doesn't work. It's more and more frustrating. And when hope is lost, it's hard to see any light. And that's what this program is providing. The first thing is to show people that there can be hope. There is a light there. And that's the beginning of recovery.
Absolutely. A practical and an evidence-based hope.
Exactly.
Yeah.
Yeah, this is real. I like to say psychosomatic problems are real, Jack. I've had them. They are real.
Right, Jack.
Excellent.
So I'd love to dive back in here and just make sure that people have the link where they can check out this program that you've created, and then we'll talk a little bit more in depth about it. So you can go to freedomfromchronicpain.com. It's all one word. Again, freedomfromchronicpain.com. And that's where you can see the whole overview of the program. And now I want to ask both of you, I know that you are both very clear on who can benefit most from this work and who is it actually not appropriate for. So can you share with us a little bit more about that detail, which is very important?
Sure. Well, as I mentioned before, it's important to be clear. It's not for cancer. It's not for autoimmune disease. How do you want to make that discernment a bit more clearly?
Yeah, this is an important consideration. We are not saying that all pain is mind-body pain, but it turns out a significant majority of it actually is. But it's important to make that distinction, and that's part of what we help people do in this program.
So really, we're talking about back pain, neck pain, headaches, irritable bowel syndrome, irritable bladder syndrome, fibromyalgia, chronic fatigue syndrome.
Insomnia, anxiety, depression. These are the major ills of our society nowadays.
And then there's other scary acronyms, complex regional pain syndrome.
Yes, right.
Sometimes
RSI, as you mentioned.
RSI, RSD, reflex sympathetic dystrophy.
Mm-hmm.
There's a whole range, isn't there? I mean, essentially what we're saying is if people have been to their doctor and they have excluded organic causes, then they could consider mind-body treatment.
Exactly. There's no infection, there's no fracture, there's no tumor, there's no inflammatory condition, which is most people.
So if someone is hearing this diagnosis and they fit, and it sounds like this program could potentially work for them, can you share a little bit more about how the program is actually structured?
Sure, Dava. Well, we believe community is really important, part of recovery. And look, it's not obligatory that people in the program connect with other people, but if they want to, that possibility is there. So we're structuring the course in cohorts of 50 people, and we've got an intake approximately once a month. Now, the program has a week-by-week structure, starting with the diagnosis and then getting those two different strands of treatment that we discussed going. So we've got the kind of neurological brain retraining, reducing the danger alarm mechanism, and then we've got the emotional work, connecting with the inner self, the inner child, and basically building the skills so that people can steadily learn more and more about how their emotional and neurological self is functioning, and then start to move into action, practical action pieces. We've got a range of exercises that are in audio and video form. There's also worksheets which help to structure people's work as they go through the process. And there's also some flexibility. So if people have more time and they're more motivated, they want to move a bit faster, they could complete the course in maybe 6 weeks, whereas other people might take, say, up to 12 weeks if they don't have quite as much time or they want to do it a bit more slowly. So there is some flexibility in the speed of it. Essentially, it has a weekly format of information that's released each week. It kind of builds on the previous week, trying to structure it and to reduce overwhelm is an important thing. A lot of people with chronic pain have overwhelm, right? Like they're struggling with their life and, maybe their situation.
And everyone's different, so it's tailored so that they can move at their own pace and they can choose the exercises that are most valuable to them.
And like I said before, we've got some specially trained therapists who support the program. So if people want to get some one-on-one backup, I know that was important for my journey. I had to do some one-on-one therapy. We've got people who really understand what we're talking about, both neurologically and emotionally, who can really support and guide people through it. And I also wanted to mention, again, the community. So there is an online learning community and a forum, so people can post on there as much as they want, get support, build community with other people in the program, but also ourselves and the therapists are going to be in there helping people out. Mm-hmm. And people have unlimited access for 12 months for the materials in the program, all of the exercises. They can do them online. They can download them as audios to their phone. So that's kind of the features. And I have, if people look at the website, they can see that I've put a few different packages there which have different levels of practitioner support, essentially. So, the basic cost of the program plus unlimited access to the forum is $297. That's Australian dollars. The second program, that's $547, includes an additional 75 minutes of practitioner time to help people with the diagnosis and the treatment. And we have a very detailed clinical form that people can fill out to capture the whole history. And they can get some one-on-one help from their practitioner. And then the other package we've put on there, that's $11.10. So that's the full program plus 5 one-hour sessions of practitioner support. So basically, those 3 levels just for however much practitioner support people think that they might need. And it's a little bit cheaper to buy it up front rather than buying the practitioner support casually later on, which is also something that people can do. And I just wanted to throw in that we're also going to do payment plans, because I know people often struggle with money. I know I did when I was going through chronic pain. So we really want to make the information accessible and affordable to people. So there will be ways that people can structure the payments over time. So just scroll right down to the bottom of the web page and take a look at the plans, and that explains the options there.
It is very generous what you've created when I think about the amount of money that people spend at the doctor, to be able to, get this information and access to it for $297, and then to be able to get 5 hours of practitioner support for, a little over 1,000 Australian dollars. That is such an offering and so much value that you're creating for people. And I feel like it's a deeply generous offer. So thank you for making it so accessible to people at so many different levels. I know there's so many people that will really benefit from it. And as I said, I'm already thinking of multiple people in my own life that I want to share with this, because I've seen people really struggling, and I know people about to have back surgery. So I'm personally grateful that you've created this program and are making it so accessible. Now, I wanted to ask you, I know that you have a special offer for people when they sign up within a certain time frame. So you want to share about that?
Sure, So the first cohort's starting on the 15th of November. So we're offering 10% off for people who sign up and pay for the program before the 8th of November.
Okay, so this is an invitation to jump in and get started and start getting pain relief very soon. So that's very exciting.
we do offer a money-back guarantee on the program. So if people aren't happy with the results that they've got after sincerely trying the program for, I think we've got 6 months on the requirement for the guarantee, then yeah, we will refund people's money. And to be clear, it's not for the practitioner time, but for the program component. Because yeah, essentially we're pretty confident we're offering something really valuable.
That's for sure.
So again, I just want to reiterate, this is such a generous and powerful offer. And for those who want to check it out, you can go to freedomfromchronicpain.com, freedomfromchronicpain.com. And with all that said, I really want to thank you, Hal and Howard, for generously offering yourselves. You are both such a vast wealth of information and personal sharing, and to really hear your personal journeys and the ways that you've been having such great success, both with your patients as well as with the research. It is really inspiring. And as I think you said at the beginning of the call, I really believe that you are up to creating a new paradigm for not just dealing with the symptoms, but really recovery from chronic pain. And that is a huge service to everyone. So I bow to both of you, thanking you for what you're up to, and really hope those of you who are experiencing some of the symptoms they've talked about will jump into one of these programs with them, take advantage, and begin your own journey to recovery right away. Thank you all.
Thanks a lot, Dava.
Thank you.